information regarding epidemic efforts in Beijing and also answer some of your interested questions. On June 26, the newly confirmed cases 17, asymptomatic cases 4, no increased new suspected cases. Since June 11, the cumulative confirmed cases 297 right now are hospitalized. Right now, asymptomatic carriers 25 are under medical observation. We are still in a critical situation in the capital city of Beijing, so we should keep high alert for the virus. Since the outbreak of the Municipality wholesale market cluster of infections, based on our epidemiological investigation and route of transmission, as well as related people, routes of transmission, their symptoms are all complicated. Therefore, there's no room for us to relax mentally. Anyone's alert or loosen alert or take any chance or relax mentally may cause new problems. The contaminated objects or environment may trigger the new way of transmission. Therefore, we need to resolutely cut out all possible route of transmission. The practice has also and always proved that the effective treatment, quarantine, epidemic efforts should continue and implement to its letters. Therefore, we also need to initiate the campaign that involves the whole public. The epidemic right now in Beijing still have many unknown factors, which waiting our further investigations, and we also need to make a practical and scientific containment efforts in an improved manner to fill in the gaps. Therefore, we need to make the high standards to our measures and also tighten our control measures to make sure that the curves are flattened. We will speed up the capability of doing NAT and also enlarging the group of getting NAT in order to better practice for early measures based on the legitimate rights and interests, as well as legal practice, as well as the jurisdiction management. We need to focus on the key sectors and also people in these key sectors in order to screen out the potential risks. And we also need to have the headcounts, resources, and investment in place, and also let all parties involved to know their responsibility as well as the rules in order to practice the scientific and precious practice. And we also need to make sure that anyone need to be tested or willing to be tested can get a test, and also to extend the channel of buying the reagent. And we need to make the price transparent, and that also can be reimbursed in the insurance. And the people in the beauty and hair salon industry, they should also conduct a deep cleaning, as well as their own people need to get a NAT, and everything should also equal and follow the practice. So people need to wear masks, and no matter for the people working in the store or the consumers, and they also need to show their health code to the staff, and also they need to do the disinfectant every time after they serve the customers. So we also have the key practice in 6 areas. So we need to always keep in mind for wearing the masks and keeping social distancing and keeping your hand hygiene, and also paying attention to the disinfectants, ventilation, as well as food safety. Today, we invite people from the Beijing CDC, as well as Bureau of Commerce, and also the experts from China CDC to join our press conference to give you more information in this regard. Please allow me to introduce our guests today. They are Mr. Wang Hongcun from Beijing Bureau of Commerce, Madame Pang Xinhuo, Deputy Director of Beijing CDC, and experts from China CDC, Madame Wang Liping. Now I first give the floor to Deputy Director Pang Xinhuo for the updated confirmed cases and the result of epidemiological investigation. Friends from the media, good afternoon. Now I will give you the information regarding the newly confirmed cases on June 26. From 0 to 24 o'clock yesterday, the newly confirmed COVID-19 local infections were 17, among which 11 male cases, 6 female cases, average age 40 years old, youngest 23 years old, the elderly 55 years old, 15 in Fengtai, 2 in Daxing by district, 16 already finished the epidemiological investigation. 1 right now is under the investigation. Now I would like to elaborate the confirmed cases to you as followed. Case 1, a 38-year-old woman living in Huaxiang Fengtai district, working for Xinfadi Wholesale Market. On 12th, transported to the quarantine area for centralized medical observation by chartered car. On the 24th, showed positive for the virus and transported to Fengtai, the TCM and Western Medicine Hospital by ambulance and confirmed as a normal cases of COVID-19. On 26th, a 51-year-old man living in Huaxiang, resident for wholesale market and also working for the wholesale market. On 12th, transported to the centralized quarantine areas for medical observation. On 24th, showed positive to the virus and transported by ambulance to Fengtai, TCM, and Western Medicine Hospital. On 26th, confirmed with normal system. Case 3, a 51-year-old woman living in Huaxiang Fengtai district, also living in the same residence and working for Xinfadi Wholesale Market. On 12th, transported to the centralized quarantine area for the medical observation by chartered car. On 24th, showed positive results to the virus and transported to Fengtai, TCM, and the Western Medicine Hospital. Is identified as confirmed case on 26th with normal symptoms. Case 4, a 49-year-old woman living in Huaxiang Fengtai district, also working for Xinfadi Wholesale Market. On 12th, transported to the centralized quarantine area for medical observation by chartered car. On 24th of June, showed positive results for the virus and transported to Fengtai, TCM, and Western Medicine Hospital by ambulance and confirmed yesterday with normal symptoms. Case 5, a 46-year-old woman living in Huaxiang Fengtai district, also working for Xinfadi Wholesale Market. On 12th, transported to the centralized quarantine area for medical observation on 12th and also confirmed the positive for the virus. On 24th, and transported to the same hospital in Fengtai district. On 26th, identified as confirmed cases with normal symptoms. Case 6, a 43-year-old man living in Huaxiang Fengtai district, working for Xinfadi Wholesale Market, self-employed, and also transport to the quarantine area. And on 24th, showed positive for the virus and also transported to the same hospital by ambulance. On 26th, it was identified as confirmed cases with normal symptoms. Case 7, a 29-year-old man living in Huaxiang Fengtai district, the same residence, and also working for Xinfadi Wholesale Market as self-employed individual, transported to the centralized quarantine area on 12th. On 24th, positive result for the virus, and transported to the same hospital by ambulance. And on 26, identified as confirmed cases with normal symptoms. Case 8, a 55-year-old woman living in Huaxiang Fengtai district, also working for Xinfadi Wholesale Market as a self-owned employee, and transported to the centralized quarantine area for medical observation, and on 24th showed positive result for the virus, and also transferred to Fengtai TCM and Western Medicine Hospital by ambulance, and also a confirmed case on 26 with normal symptoms. Case 9, a 30-year-old man living in Huaxiang Fengtai district, the same residence, working for Xinfadi Wholesale Market as a sales, and transferred to the centralized quarantine area for medical observation. On 24th, showed positive results for virus and transported to Fengtai TCM Western Medicine Hospital by ambulance. And on 26th, he was identified as confirmed cases with normal symptoms. Case 10, a 27-year-old man living in Huaxiang Fengtai district, working for Xinfadi Wholesale Market as a self-owned employee, and also quarantined in the same centralized quarantine area, and it showed symptoms a throat, and transport to the same hospital in Fengtai district, and also confirmed cases on 26 with normal symptom. Case 11, a 23-year-old man living in Huaxiang Fengtai district, also working for Xinfadi Wholesale Market. On 12th, transferred to the centralized quarantine area. On 24th, showed positive for the virus, and also showed symptoms such as a fever, coughing, and sore throat, and transferred to the Fengtai TCM and Western Medicine Hospital for treatment. On 26th, it was identified as a confirmed cases with normal symptoms. Case 12, a 29-year-old man living in Huaxiang Fengtai district, also working for Xinfadi Wholesale Market as a self-employed entrepreneur. On 12th, he transferred to the quarantine area for medical observation by a chartered car. On 24th, showed positive for the virus, and also transported to the Fengtai TCM Western Medicine Hospital. On 26th, identified as a confirmed case with normal symptoms. Case 13, a 55-year-old woman living in Huaxiang Fengtai district, the same residence, working for Xinfadi Wholesale Market as self-employed entrepreneurs, and also in the 12th in the centralized quarantine area, and showed positive for the virus on 24th, and transported to the same hospital in Fengtai district on 24th, and as identified as a confirmed case on 26th with normal symptoms. Case 14, a 50-year-old man living in Fengtai district, working for Xinfadi Wholesale Market as a self-employed entrepreneur. On 15th, he transported to the centralized quarantine area for medical observation by chartered car. On 22nd, showed negative, that showed positive to IgM. So transferred to Fengtai TCM, the Western Medicine Hospital for treatment. On 26th, he showed positive for the virus and confirmed on the same day with normal symptoms. Case 15, a 29-year-old man living in Fengtai district, working for a certain technology company, and paid 2 visits to Xinfadi Wholesale Market, and also went to the company, and also went to Baolong for interview, and also inside the industrial park. He also in the different restaurants, and also he showed symptoms on 13th and showed positive for the virus on 19th, and transported to Fengtai TCM Western Medicine Hospital, and confirmed on 26th with mild symptoms. Case 16, a 25-year-old man living in Daxing district, Xihongmen Street. Many of his friends and family members had a travel history to Xinfadi Wholesale Market, and he went to Daxing Administrative Hall on 21, went to Fengshan district for a home party and showed symptoms such as fatigue, diarrhea on 23rd. He took some medicine but didn't show a good result. He showed fever on 25th and went to Daxing Renmin Hospital and showing positive results for the virus, confirmed on 26th with normal symptoms. All these above mentioned cases, actually people related to Xinfadi wholesale market, all work for the mutton and beef trading hall. And additional cases, a man living in Huilongguan, a retired person, on 11th, he accompanied family member from Heilongjiang province to pay a visit to the Renmin Hospital and showed symptoms on 13th and on 14th and went to Jishuitan Huilongguan campus for treatment, showed positive results for the virus. On 17th, went to Renmin Hospital, showing negative for the NAT as well as IgG and IgM. On 25th, showed positive result for the virus and confirmed as a COVID-19 case with normal symptoms. These are the confirmed cases. We are coming to the end of the Dragon Boat Festival. We'd like to keep everyone to keep alert and do not conduct a public gathering or party. And please wear masks in a scientific and correct manner, especially when you are taking public transportation or in a poor ventilated places. Please wear the masks. And always keep your hand hygiene as well as social distancing. And to monitor your health condition if you showed symptoms such as fever, coughing, sore throat, protect yourself and also visit the nearby fever clinics as soon as possible. Do not go to the places that's not entitled or authorized one. And also do not travel in other places in order to avoid cross infections. And also the family members, relatives also should conduct a quarantine at home. And please monitor your body temperature every day. If you exhibited any symptoms, please report it to your local community and also went to the hospital for further treatment. Thank you. Thank you, Madam Pang Xinghuo. Now I would like to give the floor to Mr. Wang Hongcun regarding the epidemic prevention and control in the industry of hair and beauty salon. Friends from the media, I would like to give you more information regarding the containment practice as well as the large-scale screening in this sector. First, we released the industry guideline since the outbreak of the cluster of infections in Xinfadi wholesale market in order to protect the people involved in this industry as well as clients. The Bureau of Commerce swiftly adjusted the guidelines to the beauty and hair salon, so they should firmly practice the 9 strict requirements, and also everything should follow the level 2 containment practice. And this document already released to the public, and for these newly released guidelines actually had a clear requirement in the control measures. So first, it should keep the whole environment clean. For the frequently touching places, they need to conduct the disinfections as frequent as possible, as soon as possible, and also they need to keep the 2.5 square meters, and also keep the 1.5 meters in between each client, and they always need to make the disinfectants on the towels and the hair cutting equipment. And they also need to conduct the temperature checking on the clients and also checking their health code. So the people show green, in their health code, and temperature is below 37.3 degrees are allowed to enter the working places, and also need to check the employees' temperature. And during the service providing, and the people need to wear masks, and also discourage talking with the clients, and they also need to change masks frequently. And second, we also conduct a sweeping investigation and supervision. Based on the June 25th released working arrangement by the Beijing Steering Epidemic Prevention and Control, we conducted a large-scale investigation. So based on this arrangement, so we ask the individuals, companies in the hair and beauty salon need to abide by the rules and the regulations, and they also need to conduct disinfectant and also need to conduct the sweeping NAT, so which means the hair beauty salon, the nail places, so the facial places, that all be included. So far, we have checked 10765 entities. 26,286 people already finished their NAT. 1, 2, 3, 5 results already finished, all negative. So please, the practitioners follow the guidelines as well as the arrangement by the jurisdiction. Make sure everyone practicing in this industry should all receive an NAT. So the individuals as well as companies in the hair and beauty industries should be more cooperated and to further implement the measures required for further containing the spreading of the virus, and also increasing people's awareness of epidemic prevention and control in order to creating a ensured environment for clients. Thank you, Mr. Wang Hongcun. Now the floor is open. Please identify your media affiliation before raising questions. Beijing Traffic Radio. A question to Madam Wang. Right now it's in the summer season, and actually we can see more mosquitoes, whether they may be the carriers as well as the flies. They may be the carriers to spread the virus. Thank you for your question. Based on our research on the coronavirus, the root actually is ACE2. So that's basically the key carriers to spread the virus. But we didn't find that ACE or ACE2 in the body of mosquitoes as well as flies, so which means they are free from spreading the virus. And so far, there was no evidence showed that people actually contracted COVID-19 because of the flies or mosquitoes. Right now, still, the root actually are the airdrops or direct contact of the contaminated objects, and also that hands touching the mouth, nose, or ears, or eyes. Right now, there's no solid evidence to support us to say the flies or mosquitoes may spread a virus, but they may spread the other virus, such as malaria. Or the dengue. So still, right now it's the summertime. Please protect yourself from flies or the mosquitoes, and also pay attention to your food. Keep your food safe in a nice place, so that it can also keep you away from the other disease affecting your respiratory tract. From Xinhua News Agency, right now we quite pay attention to the people that such as the courier boys or the food delivery boys. So we a little bit worry about whether that we can do that direct contact with these people. So this is a quite concerned topic. Still, we need to have a clear understanding of this transmission routes. That's the really directly contact or the droplets. So that contaminated hand touch your eyes, nose, or mouth. But in a poor ventilated places, the aerosol may also be a mean to spread the virus. So we talk about a very low possibility to contract COVID-19 by getting parcels. But we also have the parcel boxes, right? So we can have that contactless service in order to lower the possibility of getting COVID-19. And also for the public, I once call on everyone to have a good routine in terms of hygiene. Therefore, that can keep you safe from different viruses and different diseases. If you receive parcels at home, before you contact or talking to a delivery guy, courier boys, please wear a mask first, and also please clean your hands after receiving the parcels by sanitizers or the soaps. And if you need to go outside, and please also wear masks and avoid public gathering. I need to as well as wash your hands by sanitizer or running water with soap. If you have your compound has a parcel boxes or the rack available in front of your a compound gate, please let the carrier boy to drop your parcel into the boxes, as well as after you get your parcels, please wash your hands thoroughly. And we talk about right now we are doing a garbage identification, right? So the packaging of your parcels should also follow the rules of garbage management. That's the end of a Q&A session. And a press conference organized by the Information Office of Beijing Municipality. You always can check our information online on our official website, as well as our apps, and also a social media platform account. And also you can find the information always available on the different media platform. And we also can check with CGTN New Media. And we also bring you the live streaming of the press conference every day. And please stay tuned with CGTN New Media for the updated information regarding Beijing epidemic prevention and control measures. So this is also available on the TV side in different channels. Thank you all the speakers and our friends from the media. Thank you all. That's the end of the presser. Thank you.